Hello, this is Dr. Wright. This is part of the Lung Pathology and Easy Bites series. This section involves a discussion of granulomatous inflammation, and this specific session addresses granulomata which have a random distribution within the lung. So the learning objectives are to develop a differential diagnosis when the granulomata are randomly distributed and to see illustrative examples of entities with this pattern. The differential diagnosis of random granulomata, you should consider the following: hypersensitivity pneumonia and infections. Infections are commonly associated with a random pattern, particularly mycobacterial disease and fungal disease, and I have a separate presentation on the dimorphic fungi. Consider also immunological disorders. In Sjogren's syndrome, you get an entity called lymphocytic interstitial pneumonia. Also consider common variable immunodeficiency syndrome. And finally, consider lymphomas and perhaps other malignancies, but certainly lymphomas. I'll show you some examples of each of these. This is an example of hypersensitivity pneumonia. If you've been following this series, you can also know that hypersensitivity pneumonia may involve airways or have an airway predominant pattern. More commonly, it has a random distribution pattern. You can see here's a granulomata which is right next to this venous septa. Hypersensitivity pneumonia is often associated with a lymphoplasmacytic interstitial inflammation. The granulomata in hypersensitivity pneumonia can be both interstitial and within the air spaces. Infections are a common association with a random distribution. In this case, mycobacterial disease, and you have to consider tuberculous versus non-tuberculous mycobacterium. This is a case of non-tuberculous mycobacterium where the granulomata are relatively well formed, associated here with a little bit of lymphocytic infiltrate, and are present mostly in the interstitium in this case, but over here they're also present within the air spaces. This is an example of an immunological reaction. This is Sjogren's syndrome, or LIP, where the lymphocytic infiltrate is present within the interstitium, and there are little collections of multinucleated giant cells, poorly formed granulomata, which are present within the interstitium. So the learning points of this session were to have a differential diagnosis when the granulomatous inflammation has a random distribution. These are your questions. Question number 1. The answer to question number 1. Question number 2. The answer to question number 2. Thank you. I hope you've enjoyed this rather brief session on granulomatous inflammation having a random distribution. Your comments, as always, are gratefully received.